100.3.
With the first guest in the studios, Dr. Derk Krieger. He's a neurologist with more than 30 years of experience across Switzerland, Denmark, Ohio, and now he is in the UAE. His main areas of research involve acute stroke care and neurocritical care. Hi, doctor. How are you doing?
Thanks, Ron. Thanks for having me.
Absolute pleasure, sir. Tell us a little bit about yourself.
Well, I came to the UAE 10 years ago, and I've worked in several clinics in the private sector, and I've built a stroke center during this time for patients with acute strokes, which has been quite successful. And now I have ventured into a disease that becomes more important with aging, neurocognitive disorders, cognitive decline, Alzheimer's disease.
Absolutely. And this is something that I really wanted to talk about on the show for a very long time, but we've never had a chance to actually talk especially about Alzheimer's. Before we, get into that, since you've worked in different countries and with different kind of diverse populations, what's the kind of difference that you see here in the UAE? What kind of problems do people come to you with mostly?
Dubai is a very high octane place. So people are stressed. A lot of people are very much stressed, and depending on their disposition, on their mental health, they can become very anxious and even depressed. So we have to do with a lot of these mental disorders in our practices. So that is different from many other places I've been.
All right. So stress is one of the main drivers, you feel, because it's a young country and people are working. It's a very work-centric place, where no one's retiring over here. Everyone's just working. I mean, once you are at the age of retirement, you probably move back to your home country. But talking about Alzheimer's, what exactly is it? And do you think there's enough awareness about it?
Well, the awareness is dependent on what we can do for it. So there hasn't been much awareness, in particular in this country, because as you said, Ron, it's a young country. And so Alzheimer's is a disease, a brain deterioration, like a neurodegenerative disease that starts in your 50s, maybe 60s. And there's two peaks. There's one in the 60s and one in the 80s. And believe it or not, about 5% of the population below age 60 has Alzheimer's disease. 5%.
Do they know it?
No, they don't. And we're going to talk about this, why and how we can change
Absolutely.
that. But if you look at the little older ones, in the 70s, there's like 10-15%. 10-15%. And if you look at the 80s and above, it's 1 out of 3. So it is a prevalent problem. And, you were just making this point. The problem with this disease is two proteins. One is amyloid, A-beta, amyloid, A-M-Y-L-O-I-D, and the other one is called tau. These are two proteins or peptides in the brain that are intimately involved with Alzheimer's disease. They are associated with this. I would say that there is a lot of amyloid deposition in brains without Alzheimer's, but there is no Alzheimer without amyloid.
Oh, okay, like that. And, since you said that there are populations which are aging, of course, facing it, but those below 50 are also, or below 60 are also experiencing it. But this could also be just as well normal aging, like you might say, oh, it's my age, I don't remember things now. We usually just discount it as aging. So do you think that's where the crux of the problem lies? Because most people don't even realize until it's too late that they are indeed suffering from Alzheimer's.
Yeah, this is a very interesting point, Ron. Number one, the deposition of this amyloid that I mentioned happens about 2 decades before you notice anything. So let's say an early Alzheimer case, age 60, age 55, something like this, with a little bit of a cognitive decline. Well, the deposition of the amyloid has happened like 20 years before. So the people were here. The people just didn't know about it. It's a little bit like the cholesterol problem and the heart attack, but this is like new. We have to think in the future, The problem happens with age 60 and age 70, but we can do something earlier. So the main reason why people are not talking about this now is, number one, there hasn't been a treatment, there hasn't been an awareness, and people are young and are not thinking about this.
Right. So, I mean, I must tell you this, that personally, I a lot of times feel like I'm in my very early 40s, and I really feel that there are things I forget. I forget people's names sometimes. I forget their faces as well. I have sometimes difficulty remembering the place I traveled to, the name of that place or the hotel that I stayed in. Is that, I mean, and I've spoken to people in my age group, and they say, yeah, it happens to us as well. Is that a warning sign? Is that how it starts presenting itself?
Well, I wouldn't say it's a warning sign in your 40s, but it does present itself like this. You have two kinds of intelligence. One is your fluid intelligence, which has to do with, fast tracking, multitasking, things like that, which has to do, with the integrity of the fiber systems from the brain to the hands and all of that. And then you have something called a crystalline intelligence, which is something that we could translate as knowledge, something that you build up over your lifetime. So while the fluid intelligent is deteriorating, actually after age 27 you can see the decline, but it certainly deteriorates more after age 50 and 60. The crystalline intelligence is either stable or improves depending on lifelong learning, for example. If you're socially isolated, if you don't go out, if you don't do anything, then of course you're not going to increase your knowledge base. But if you perform lifelong learning, then you will.
All right, we'll continue talking to Dr. Krieger about Alzheimer's and everything that comes along with it, and the early signs and how you can prevent it if at all you can.
Life Talk 100.3.
11:12, we still have Dr. Krieger with us. We're talking about Alzheimer's. He's a neurologist with Fakeeh University Hospital. So one of the early questions that we've got is from Max. The question is, what is the difference between Alzheimer's and dementia?
Dementia is like the title of several degenerative diseases, and one of them is Alzheimer's. Parkinson's is another one. Alzheimer's disease is approximately 70% of the dementias. So if somebody gets demented, it is very likely Alzheimer's disease.
So dementia is an overarching condition,
Yeah.
and Alzheimer's is part of that. Okay, and if I were to ask you, what are some of the risk factors for developing Alzheimer's disease? What are we doing wrong?
Well, there's a genetic disposition and there's aging. There's nothing you can do about that. But there's a lot of things you can do. Lifestyle. Start with exercise. I mean, the rules that apply for a healthy heart also apply for the healthy brain. Yeah. So a cardio in the gym is important. Stay away from bad, highly processed food is a consideration. But then also take care of your mental health. So anxiety, we talked about it before, anxiety issues, panic attacks and depressions, they need to be treated, in particular when they're associated with insomnia. Insomnia is the inability to sleep. So a good sleep is very, very important for us.
So if you're saying, like, what you're saying is, like, people get stressed all the time, If you're stressed, but if you're able to have that good night's sleep, then is that okay? Because you can't avoid stress, but...
No, you cannot avoid stress, but what you need to do is, I always tell my Muslim patients, you have 5 prayers a day, so use them for self-reflection and meditation. So you need to stay away from, this high-octane environment all the time. You just need to find your little oasis that you can enjoy.
That's something that everyone can do, I mean, there's just so many things you can do in that, and therapy of course helps. But you spoke about sleep. So what is the role of sleep in cognitive functions?
Sleep is a very interesting fact. I mean, we always think we're resting. Well, the body is resting, but the brain is not. The brain is being maintained. The night workers are there. What are they doing? Well, they're doing 2 things. They're consolidating the memory. So whatever you have experienced during the day needs to be put in context with your experience in order to build this knowledge base that I talked about, the crystalline intelligence. And this happens at night. And it's very, very important that you have deep sleep, REM sleep, we say, dreaming, where during dreaming these things happen. And then the other function of sleep is to declutter the brain of toxic or waste products. If you don't sleep, it doesn't happen. And they, like the amyloid, for example. If we would have better sleep, the amyloid, which may cause Alzheimer's, would be deposed.
it'll be eliminated from your system. So does it mean that dreams are healthy?
Yes, absolutely. I mean, there are nightmares, and of course, I mean, this is a completely different story. We can talk about this another time. But dreaming is when the brain brings new memories into contact with old memories.
Right. I always thought that dreams probably wouldn't be healthy because, your mind is still constantly working because we're so aware about most of the dreams when we wake up. Many times we forget as well. But like I remember what my dream was last night. I still remember it right now. So why do dreams come? But then in that case, like, is it that the mind is constantly still working?
Yes. Exactly. The brain doesn't sleep. The brain is always working. It's either helping to consolidate those memories, It's either helping to consolidate those memories. And by the way, the dream that you remember is the last one. You may have had 5 before that you don't remember. So they happen whenever you have very deep sleep, and in particular during the REM sleep, when you're paralyzed and only the brain is working. And this happens like 4 or 5 times a night at least.
Absolutely. And, with dreams, it's also they say that, you mostly remember the last thing that you did, and that kind of gets replicated in your dream. So at least one thing is clear from what you're saying, that dream means you are having good sleep, you're having healthy sleep because you are in that state of mind. All right. So also now one of the things that I want to ask you is that how can we maintain our cognitive health as we age? Because there is no cure for Alzheimer's.
No, there's no cure for Alzheimer's yet. We're going to talk about what can be done. But what you can do yourself is, if you remember what I said about this fluid intelligence and the crystalline intelligence. So the fluid intelligence is like your hardware. So you need to deal with your hardware as you deal with the other hardware in your body, the muscles and bones. So you do exercises, you live a healthy life, you eat healthy, and you avoid, smoking, drinking, and these kind of things. And then in order to address the crystalline intelligence, the knowledge base that is important because it gives you an edge in the age, and it may grow when you get older. Everything else falls down, but this actually may get better. So how do you do that? Well, you do that by avoiding stress as much as you can and taking good care of any mental issues. Then stay social. Stay connected to people. It's very, very important. And lifelong learning.
It's interesting you never mentioned medicines even for once.
Well, the medicines have been used for people that are being diagnosed with dementias. And we have a group of medicines called memory enhancers, which have a limited, but they do have an effect, but it's limited, and it doesn't affect the trajectory of the disease. So right recently, about last 2 years, new medications have become available that actually take care of this excessive amyloid plaques. And these are the medications that we may want to talk about in the next.
Yeah, sure. We'll talk about treatment and also how to keep brain active, because that's the question that we've got from Soha, because you said that brain never sleeps. So I am also interested to know, when is brain's downtime really?
Live Talk 100.3.
11:28. We have Dr. Krieger with us, still from Fakeeh University Hospital, and he's a neurologist. We're talking about Alzheimer's. Doctor, we've got a very interesting question just popped right in on our WhatsApp. I'm in my late 30s, and at times I find it difficult getting the right word, or sometimes completely lose the track of what I was thinking. So what could it be?
Well, Sheena, you're not alone. That's for sure. There's a lot of people with these concerns. And if you're in your late 30s, I'm not overly concerned that you may have Alzheimer's disease at this point. Unless you have a very strong family history or something like this. Most typically, this is like an anxiety or like a lack of sleep. I told you before that it's so important to dream and to have a good night's sleep in order to make all the maintenance work in the brain. And if you don't do it, then you cannot concentrate the next day, and you cannot just take these things in. So it's not really a hardware problem. It's more like a software problem, and you can deal with it by, mindfulness and by, giving yourself a routine, go to the gym and things like that. You can also see a professional, of course.
Right. Soha is asking how to keep the brain active.
With aging,
Yeah.
yeah, well, stay tuned, lifelong learning. Make sure that you have a network of social contacts, extremely important. And these things are important because they motivate you. Go on trips together with people, learn a new language, things like that. Enhance your knowledge pool, which you can do over the ages. In terms of the fluidity of the intelligence, you probably better just do exercises, and crossword puzzles don't really help. It needs to be something more complex,
How about games on mobile?
Yes.
They can help,
Yes, they can
but
help.
not in an excessive manner.
No, I don't think so. I mean, intelligence or human brain is much broader than any of these little gadgets can do. But there are some intelligent games that you can do, and certainly there's a merit to that.
People speak about IQ all the time. Is there something called as IQ and EQ?
Yeah, of course. The IQ is we were talking about the fluid IQ and then the crystalline IQ. This is what you assemble over the years in your life, and that is your intelligence. And the emotional intelligence with the EQ is something that has nothing really to do with intelligence per se, but it is very helpful in order to make social contacts, for
And
example.
feel things.
And feel things and enhance your knowledge
Right.
base.
Right. A lot of people say, and we've heard it so many times, that you should have almonds, to have good memory. You should have different kinds of almonds, to have good memory. You should have different kinds of dry fruits, and everything is associated with, these kind of conditions and maintaining a good brain condition. So, is diet in any way connected to brain health?
I think diet is very important. Diet, we always talk about the highly processed food. Avoid that. Cooking yourself. There's also the gut-brain axis, which is a lot of talk about with the microbiome and all of this. It's very important to use probiotics, kombucha tea, for example, things like that. I think curcuma or turmeric has a role. So I think that's
Turmeric.
turmeric. Yeah.
Okay.
I think it plays a big role in maintaining a healthy gut-brain axis.
All right.
So these things are important.
And is almond good for memory?
Is what?
Almonds?
Almonds, yeah, they are. Nuts. There's not a lot of research in this, but they have a lot of fatty acids, healthy fatty acids, unsaturated ones, a little bit like fish oil. It's similar to that, and that's very helpful. Yes.
All right. So now, since none of these things are still going to be a guarantee that you're not going to get Alzheimer's, even if you have a good sleep, even if you have those brain activities, if you do your exercises, there's still a chance that you might end up with Alzheimer's. So what are the early diagnoses of Alzheimer's?
Yeah, I think this is a crucial question, and you're absolutely right, Ron. We need to make an effort to get people earlier to be diagnosed. And the first thing is people themselves. If you don't come to a doctor, what can we do? Nothing. So I think a crucial age for this, and this may change. Just don't quote me on this in 5 years. But at this point, I would say 55 years is a good age to start being assessed for this. And you go to a neurologist, a geriatrician, to somebody who is affiliated with a memory clinic. That, I think, is the name. Stroke clinics for strokes, memory clinics for Alzheimer's. So a memory clinic, a cognitive health department, those are the departments that you can go, and they do comprehensive tests. First they do paper pencil tests, like intelligence tests. Then they do something, the mini mental state examination. They do the MOCA test and things like that, which gives a broad idea about those two intelligences that we talked about before. There's also, and this is new, devices like iPad devices where you can do little games, and then they are artificial intelligence powered, do deep learning, and they can tell you in particular what the fluid intelligence decline. And when you have diagnose this point where there is something that we call a minimal cognitive impairment, then you can go and get some biomarker testing. What is that? Well, it is an MRI to see if everything's okay. Then the other tests are blood tests. And depending on what the results reveal, you can do EEGs, which are like EKGs of your head to see if there's any cortical dysfunction. And all of these things together can make the diagnosis Alzheimer's relatively early on, before you have any memorable decline. So nobody might actually notice anything at this point. I have some patients that I treat that they have nothing, and even in the tests that I do, they got better with treatment, and they stay like that. So it's all about getting them early so that you can affect this trajectory of decline, make it more flat or even. That is the most important thing, because the marbles that you have lost, you will not retrieve.
Right. So, but it's ironic, because you can run the test and you can know that somebody's going to get this and are having that problem, but there's really no cure to it. So now, what is the treatment like then?
Yeah. So this is very new, and it is a little controversial. But I think things will fall into place like a puzzle. We have treatments called disease-modifying treatments. Those are monoclonal antibodies that are used for all sorts of diseases, and they're targeting certain things, and in this case, they target the amyloid, and they help the amyloid to be washed out of the brain and not affecting toxicity onto the brain cells and then causing havoc. So these are the treatments that we have available since about 3 years, and they have become better. And new versions of these treatments are coming in, and they are the first treatments that they don't bring back a lot, but they flatten the curve. So you can say with the last generation of treatments, you can probably reduce the disease progression by almost 50%. And that is substantial.
That is something, yes. But do you see surgeries coming in later on, robotics, AI, helping in your field, especially for Alzheimer's and dementia?
I think surgery is not really the answer for this. Surgery is an answer for other problems.
Hardware problems.
For example, in Parkinson's disease, you can do deep brain stimulation surgery and affect the tremor, for example, but you cannot affect the progression of the disease other than with pharmaceuticals. And the pharmaceuticals we have now are based on eliminating this amyloid that we think is toxic. But there's a lot of other options that are being currently investigated, in particular when it comes to immune responses. It seems that a lot of this decay that happens with neurodegeneration, not only in Alzheimer's disease, but also, for example, in multiple sclerosis, have to do with progressive immune attacks to the brain. And those need to be addressed as well, and we haven't done this yet.
But this pharma that you're talking about, does it also come with a lot of side effects?
Yes, it does. It does. Nothing comes without a price. It's not cheap. But this is a different story. The side effects, I have been lucky with my patients, or my patients have been lucky with me, or however you want to put it. I haven't seen any problems. But in some of these patients, in particular when the patients are progressed and they had a little problems with little bleeds in the brain already, they are slated to run into trouble with blood bleedings even in the brain, and so we got to be very careful about this. But for the most part, these medications seem to be safe, and if you are under the care of somebody who knows what they're doing, I think it's a safe thing to do.
All right. And insurance, does insurance cover Alzheimer's, dementia, or Parkinson's?
That question pertains to the UAE, and I think the answer is
no.
Somewhere in between, or even no. I mean, there's obviously the local population that is fully covered, and then there are some people who chose
that kind of insurance.
That kind of insurance, and they're
so
covered.
So you say a more premium insurance would cover it?
I would say so, yes.
Guess it will be a while before
Yeah.
we can get
But
around insurance
if you
companies
want
to
to talk
cover.
about this for to get people an idea, so that they have an idea of what they're up against. I don't know the exact prices or anything like that. These medications are not cheap, but it turns out that the new generation of these disease-modifying medications, they only have to be given for a certain period of time, because when they have cleaned the brain of the amyloid, then the job is done. And so that reduces the price, of course.
But clearly it wouldn't be one time. Like, I mean, if it's done, after a while it can always come back.
It's, if you use these medications over 1.5 to 2 years, 90% of the patients are devoid of any amyloid in the brain. And then it takes decades again for this to come. We don't know the details of this yet, of course, but it takes some time. So you can actually, if you have a lot of amyloid, in any of these biomarker findings, you can start with the treatment with a very, very mild memory decline, let's say. And then you treat 2 years and you stop. And then you check your biomarkers again. And if
needed, you start.
If needed, you
Sorry,
start
I'm
again.
sounding too cynical, but I've seen way too many conditions where, where things come back. But then obviously it's a good start. And the fact that it can be tackled with medication, that's a really good sign.
I think one very important point I would like to make, Ron, is that this all only works with very good caregivers, because the patients are a little bit lost sometimes, so they need to have good caregivers, and there need to be a compliance. So there need to be good compliance with the medication and with the treatment team.
Right. We'll come to that and also take a few more questions, and also would like to hear some heartwarming stories, because clearly your line of treatment and what you do is so deeply involved with patients and their families' emotions, because it really is about the brain condition and about how they behave.
Talk 100.3.
11:46 and we still have Dr. Krieger with us. This is your last chance to ask him anything about mental health, about Alzheimer's. He is a neurologist from Fakeeh University Hospital, and we're getting some questions. I mean, this is a question again about mental health. This is from Rahul. He's asking, what are the most recommended approaches for someone struggling with depression to find relief and improve their mental health?
Extremely important, because depression and all that it causes, social deprivation, bad sleep, all of these things over a long period of time can trigger amyloid deposition and set the seed for Alzheimer's disease. So it's extremely important to address these issues. If you have depressions for, let's say, more than 3-4 months, you should see a specialist, a healthcare professional, and be evaluated. It's difficult, Raul, to give you some individual advice over the radio, but I think I mentioned already that there's a lot of things that you can do yourself pertaining to your body's health, with cardios in the gym and things like that, and mindfulness exercises and things like that. But you probably want to see a specialist to really know if there's any medications that need to be added or so.
Start with sleeping well, I would say.
Yeah.
Right. Also, one of the things that comes to my mind is how celebrities in Hollywood especially have spoken about mental health issues. Now, because of that, in the Indian film industry with Deepika Padukone and a lot of other actors have come out and said it openly. Earlier, there was a lot of stigma around it. So how much do you think as a doctor it helps spreading awareness?
I think it's crucial. I think it's absolutely crucial, and I would commend these people to come out with this, because yes, there's a taboo around it, surrounding it, and a lot of people, they wrongfully feel that they should hide this. No, you should not hide this. You should not hide anything that can potentially be treated.
Right. But especially for celebrities, it takes a lot of courage, because the minute they say that, it means that the work will start drying up. They wouldn't get any more offers. Directors and producers and studios won't put money on them, because I mean, it's a ticking time bomb at the end of the day for them.
Yeah, you're absolutely right, and it's not doesn't have to be a celebrity. I have a story of a patient who actually has Alzheimer's disease, diagnosed she very early stages, and anything could be done, but she didn't want to. Well, why did she not want to? Because she is a physician, and she would lose her license.
Ah, right. Okay.
So there are issues surrounding this, and they need to be overcome because there are treatments, and the same thing applied to strokes 30 years ago.
Right.
Nobody with a stroke came to the hospital. There was nothing to do, and they came 3-4 days later for a rehabilitation. It's too late.
Yeah.
But now we need to understand that, first of all, as I said, the marbles that you lost cannot be retrieved, but you can clean your brain of the excessive amyloid and then set you on a completely other target.
Absolutely. And with stroke, I mean, my father, when he was traveling over here to Dubai a year and a half back, he had a stroke here. And it was so difficult because we didn't know for the first 2 days, we didn't realize the symptoms are because he has sugar and he's got, hypertension. We thought it's just low sugar, maybe. We thought it's just weakness. And by the time we got to know, it was kind of late, but thankfully he recovered because we then, got some help over here and stuff like that. But stroke is another problem, which people don't realize for a very long time. They don't know what symptoms, what is happening to them and their loved ones. And by the time they get to know, it probably is too late, isn't it? So is there anything that you want to say to them, like if somebody is experiencing symptoms of stroke, what should they do?
Yeah, stroke is a little bit of a different topic. Because it's an acute disease. Alzheimer's is something that insidiously, grows on you and progressively gets worse. But a stroke happens like a firework, and then, if you're lucky, it resolves, and if you're not lucky, then you end up in a wheelchair in the worst case scenario, even dead. But for stroke, we have treatments available with thrombolysis, where we take the clots out or where we lyse them with medications, but we can only do this within the first hour. So don't do this again, Ron. If you think somebody has a stroke, don't think it's weakness, it's going to get better, or it's sugar or whatever. Just send him to the emergency room of a hospital with a stroke center.
I didn't know any better. So
yeah, I know,
yes,
but
the
that's why I'm telling you.
No, thank you so much. And the symptoms are very misleading, and especially even like I said, we started the chat by saying that for Alzheimer's as well, the symptoms can be just normal aging. Oh, it's my age, I'm forgetting things, without realizing that this is leading you to somewhere.
Let me just tell you this. In my profession, we always say, don't treat family or close friends. Why? Because you don't want to take shortcuts, because they hit you after all. And this is exactly what happens. You have to, bring patients to professional care. They look at it from all angles, and they do the best they can with anything out there. So don't hesitate.
Absolutely. Also, before we let you go, finally, if there is any story that you want to tell us, because you work with so many patients, and they're, it's about their mental health, and it's about their family's emotional health, their own emotional health also, and a little bit about the caregivers as well. Is there any technology that's coming or it's there for giving care? Because care is such an important part for patients of Alzheimer's, dementia, or Parkinson's.
Yeah, thank you for giving me the chance to tell you a little bit about that. My personal experience, I mean, I practice 10 years in Dubai, and I see a lot of patients over the time. Alzheimer's disease is something that has only recently become important because we have a treatment now. And so I have started treating Alzheimer patients 3 years ago when the first of these monoclonal antibodies became available. And it was not like you see an improvement like, somebody
drastic
phoenix out of the ashes. It's not like that. But it's incredible how stable these patients are over a period of 3 years, over which they should have deteriorated into an asylum. in a mental asylum, and they don't. And everybody has their own story. Every patient is different. The dementia, the trajectory that takes them down, hits them in different abilities of their brain. The more knowledge they have, the more crystalline intelligence they have accumulated, the longer they last. And that's very, very important. And when it comes to caregivers, I want to tell you that I really adore their devotion and passion to the family members and also the professional ones. And I want to just mention this one group they called Forget Me Not, and 4 is numerical, and you can find it on the web if you're interested. It's a wonderful group of people who support caregivers. Other support you can get when you accompany your loved one or the patient with Alzheimer's disease to a professional, and they will talk you through the options that you have and what you have to think of and what you have to do and all of these kind of things. And I have put together a brochure, an educational material over the past year. And it is available for free on the website of my hospital, FUH.
.care, is it?
It's.
But if you just put Fakeeh University Hospital, you will find the website, and there you can find it.
Yeah, you can find it there, and you can download it, and it is a comprehensive repository for families and caregivers about Alzheimer's disease.
Yes, that's the website, fuh.care, because I was
FUH.care.
looking up at your profile on that.
Yeah.
So
FUH.care.
Yeah, absolutely. Thank you so much, Doctor. Just one last question before we let you go has just popped in. This one's from Rishi. He's asking, do women suffer more from Alzheimer's or men?
Women suffer more, but that's statistically tricked because they get older. That's why. Age is the most important risk factor for Alzheimer's, and since women get older, they have more Alzheimer's disease.
They get older, meaning they
older
live,
than men.
They live more?
Yeah, they live longer.
Okay.
10 years.
That's the average.
Yeah.
Even in the UAE?
I don't know about the UAE, but in all European countries, and I think in India as well.
Yes.
It's about 10-year difference between men and women. We have to do more, men.
All right. It starts with understanding what problems you have. That's half the battle won, and which is what early diagnosis is all about, which is what happens in Alzheimer's. Very, very important. Thank you so much, Doctor, coming in today to the studios.
Right. Thanks, Ron, for having me. Bye-bye.
Bye, sir.